In November 2014, the Maternal and Child Health Bureau Division of Healthy Start and Perinatal Services hosted the 2014 Healthy Start Convention, a new era of Healthy Start, emphasizing quality and planning for success. This is a recording of the Evaluate Need and Impact plenary featuring Sharon Crawford Corll from the Association of Maternal and Child Health Programs and Dr. Jeffrey Guidry, Healthy Start Evaluator, Texas A&M University.
So again, I'm Sharon Crawford Corll. I work with AMCHIP, I see lots of familiar faces around here as I walk through kind of the meeting when I came in. And I've been there for 11 years. I like to say I grew up there, and there's been a lot of changes. I think many of you know that our members are also MCHB-funded organizations at the state level, and they are also doing needs assessments. Theirs are on a 5-year cycle, and they do these intensive kind of statewide needs assessments. I've been there since 2003, so this is my third one that I've been a part of, and as the workforce development lead at AMCHIP, I've kind of helped provide capacity building support for them in the past number of them. I will say, Dr. Liu, I was looking at his bio, and he's only been there since 2011, and I would say he's not in the room, but man, what disruptive but great change that he's instituted in the 3 years that he's been there. I mean, he really is helping change our programs, Title V programs, but this revamping of Healthy Start, really to help us be aligned to tell our story about what we are doing to actually improve birth outcomes. Healthy Start programs are specific to improving perinatal outcomes and birth outcomes, and our members kind of work across the lifespan, so we get into adolescent health and young adult health and actually women's health as well. But the cornerstone of MCH is birth outcomes, and so I was really excited to see some of the amazing changes that he's making and transforming Healthy Start. And I preface that, my presentation by saying we're partners in this. Our members, state Title V at the state level, are your partners in this because they're doing a lot of the things that you guys are charged with doing. So I would just say, welcome all the partners, and we are big partners. In fact, every state and territory has an infant mortality coin. You guys are going to be introduced to the coin concept a little bit later, but the infant mortality coins are going to have a lot of the data that you guys are going to need or have done some of that, at least at the state level, that you can kind of capitalize on. And so without further ado, I'm going to get started. How many people have done a needs assessment before? A lot of people. How many Healthy Start grantees, how many new Healthy Start grantees do we have? New. And of the new, how many of you have done a needs assessment? Okay, so we have a lot of knowledge in this room around needs assessment. I hope you were kind of looking around at your peers and saw who raised their hands. Those are the sages. If you have any questions about needs assessment, kind of tap into them. We've been doing trainings for our members on needs assessment, and generally they're 3-hour skills building, so I'm going to try to do this in 30 minutes, so it's going to be very high level, but I think it'll be a reminder for a lot of folks in the room, just if I took kind of a good pulse there with looking at the number of hands. And I use a lot of pictures because that's kind of the way that I do trainings, but I just wanted to let you know that I have a step-by-step guide on your tables that kind of walk through in more detail, particularly when we get to the slides on qualitative data. There's a lot of exciting techniques in there that have like a little blurb to hopefully you'll get excited about that as a strategy, but just to give you that, to let you know, I've got a little follow through there. So what we're aiming to do, I'm not going to read this to you. I think you guys can read that yourself, but really we're going to talk about why we're doing a needs assessment, what a needs assessment does, some potential data collection methods and sources, some key steps to turning your assessment into action. I mean, what's the point of doing the community needs assessment if we don't do anything with it? And, understanding the importance of monitoring and evaluation, which actually Jeffrey's going to really pick up on that and hone that in. I'm just going to mention it. He's the expert over there. As he said, he was a child when he started, so. So this is a bunch of tools, if you can see that, and really your needs assessment is a tool to take you from where things are, right, to where they should be. And with the revamping of Healthy Start program, you guys have a pretty good picture of where things should be, right? We want women breastfeeding up to 6 months. We want people to practice reproductive life planning. We want, all these things happening. And your community needs assessment is the tool that helps you figure out, well, where are we now? Are women breastfeeding? Are they, practicing birth spacing? What is the prevalence of smoking in our community? And so, we want all of those to be improved. We want less people to be smoking. We want more people to be, planning their pregnancies. All these kind of outcomes. We want less prevalence of family violence and intimate partner violence. Well, your community needs assessment is a tool that helps you kind of measure that and also give you some steps on how you're going to get there. I know that it's cliched, but if you don't have a plan, you don't know where you're going to go, right? If I don't have a destination on the roadmap, I'm just going to keep driving. I might end up in, I don't know, Cuba or something, but I really wanted to go to Florida, but I didn't have a process. So your community needs assessment is the tool that can kind of help you get there. And your needs assessment is the first step in EPIC. I love that, EPIC. So it's evaluate need and impact. And I would be remiss if I didn't say that any kind of undertaking like this, it has to start with planning. And I think you have to plan before you start this journey. I know I talked about it as like a roadmap. You're taking a trip in your community and figuring out kind of the needs and assets. But the carpenter's rule is measure twice, cut once, right? You never want to go back and be like, ooh, I wish I would have thought about that. And so planning, when you're doing the community needs assessment, it involves things like answering questions like who's going to participate, like what, is it my entire community, who is going to be part of the leadership team that's going to be doing this, like all of these things, like the who, the what information are we seeking? You guys are lucky in the sense that you have clearly defined information that you should be seeking. You have performance measures that you're responsible for. All those things about the percentages of this and that, these are things that you already have identified information that you're seeking. And when will it be conducted? Can I do this all at once? Will it be phases? When should I time this out? And what will it cover? The whole city, particular communities, how's that going to look? And how will it be done? What is our methodology? And so, all that planning kind of sit down, and the way I like to do that, I'm a very kind of visual person, is I take sticky notes and I stick them all over the wall. If you ever came into my office, I have big like graph papers. You probably think I'm crazy, but it really does, and I can move them around and I could say, ooh, I didn't think about this and that. So planning, is really the first step. And then the next step is thinking about your collaborative partners and allies. You're going to have your internal team that's going to be a part of that. But you should think about all your community stakeholders. Really, this is such a critical piece of doing a needs assessment. And you guys have a community action network that you're going to be doing. You're already charged with building a group of partners that are going to be kind of your allies in the community. And then a really important thing anytime you undertake any project is scope. What's in and what's out. I think this is important. There's this word called scope creep, because suddenly your community assessment is this, your community needs assessment is this, and then suddenly it becomes much bigger than that. And then suddenly it's more than you have the capacity to handle. So, you want to make sure you clearly define what's in and what's out. And that's particularly important when you're communicating with your staff or community members or your project officer at HRSA, because, that's your guide. And that's going to ensure that you're successful in kind of implementing what your community needs assessment is designed to do. And so, some of the key questions in there that are on your thing are like, the community needs to be assessed, the community members, the geographic area, the key questions, the level of detail you want to include in there. And that's a really critical kind of step. And then I love this visual. It's a little kid with binoculars, and he's got his hat on. And it was especially relevant for me because my husband did just get back from Africa. But your community needs assessment is an opportunity for you to explore your community and really be that kind of, have that sense of adventure of like, what is going on here, And not just looking at data like, here's the number of incidences of domestic violence, but why is this happening in my community? And having that sense of adventure and like, maybe I should have put Sherlock Holmes there, and uncovering root causes or using some deductive reasoning. But I thought since we worked in Healthy Start and, we were all about kids, a kid with, their sense of adventure and kind of curiosity would be relevant to all of us. And so the reason we do a community needs assessment is to collect some data about our community, right? So we got to figure out what is going on around all these kind of things that that we're now held responsible for, like women's health, you know, all the different things in women's health. And so data collection, I think everyone here, I saw pretty much everyone in the room has done a needs assessment, and I'm sure even new Healthy Start grantees have done data collection as some part of your experience in the past, and I see some head nodding. But it's the process of gathering information. You need to make decisions. I think this is a really important step, and it's funny, you've been doing evaluation for 20 years, but I think we spend so much time collecting the data that we don't think about what we're going to do with it, and that we don't use that to make decisions. And I think, you know, that's something we can improve. I think overall we're kind of scared of this. Like, well, I know that I know how to look at this data, or I don't know what it's telling me. But your question in doing the data collection around community needs assessment is, you know, what data is needed and how am I going to get it? And so you have performance measures. This is great. You're charged with improving women's health. That is huge, right? Do you know how healthy women are in your community? What are their issues? Is it heart disease? Is it diabetes? Is it, you know, what is it? What are the issues in your community? Promote quality services. I mean, this is huge. You saw in that chart that kind of was the outline of whatever you call that smart art. Healthy Start was in the middle, and you guys were connecting them to all those other kind of community partners. Well, how do we know those community partners are like providing quality services? So, you know, and are they, you know, so you're going to promote those kind of quality services. Strengthening family resilience. Wow, that's a big one. I saw your performance measures for that one, and I got to be honest, like that one's going to be tough, but I'm excited about it. And I have to say, you have partners. You have partners like the home visiting programs. You know, how many of you have heard of home visiting? You know, they had to do a needs assessment, and they're responsible for similar kind of outcomes. And so there's some partners there. They might have figured out how to kind of get their arms around that a little bit. So if you want to be connected to home visiting, we can help you do, the home visiting folks, we can help you do that. And achieve collective impact. You know, really what that's saying is, hey, we got all these community partners that are working on these issues. Why can't we come to the table and talk and agree that we all have the same kind of destination in mind? We want to improve women's health. So Judy, you might be doing this, and Peggy, you might be doing that, and Tom, you might be doing that. But here's our vision, and we don't got to be doing the same thing. We all have a niche, but we're all striving toward X, you know? And that's what I love about collective impact, because it gives us kind of some platform to describe why we think it's important for all of us to be talking about this stuff. And I think the person after me is going to be, not Jeffrey, but the next session we'll be talking a little bit more about collective impact. And increasing accountability through quality improvement, performance monitoring, and evaluation. I could say the one thing that Dr. Liu has done and turned kind of all MCHB funded things on their head is, I mean, the increased accountability. And I can't share. You know, he gets called up to Congress and says, why are you spending these millions of dollars? And he has to be able to tell a story. And they don't want to know like this. They want to know, what is the impact of your programs? And, you know, so he has to be able to be accountable. And that's kind of, you see this increased focus. Improving women's health, and there's some things, you know, looking at your community capacity for outreach and enrollment. I mean, are women having health insurance so they could go and do these preventive screenings? You know, is someone coordinating and helping facilitate services? I don't know of anyone that's ever tried to navigate your own insurance policy, but it's like ridiculous, you know? And I work in public health, and I still don't understand some of that stuff. You know, supporting prevention, this is huge. Reproductive life planning, interconception health, is this happening in my community? Promoting quality, you know, are things being coordinated? Is there systems integration? Does Judy have to go to 17 different spots to like get her kid the services it needs or to get her prenatal care? That's not systems integration. Right? Judy shouldn't have to do that, because guess what? By the 5th place, Judy's done. I'm not going to 17 places. And so, you know, that can help facilitate her, you know, experience with getting prenatal care and increase your numbers. And obviously focusing on prevention and health promotion. I mean, breastfeeding, immunization, family planning, fetal alcohol syndrome, smoking cessation. Strengthening family resilience, you know, addressing toxic stress and supporting trauma-informed care, mental and behavioral health, father involvement, you guys are the leaders in father involvement. We actually look to a lot of what Healthy Start is doing to kind of help our members bring males into the MCH programs. And I'm so excited that you're going to continue to do that, because we know, maybe not as much in this hemisphere as other hemispheres, but there's a lot of, there's an increased role in males in families. I mean, I remember when I was a kid, my parents got divorced, and like that, my dad, that's ended his, not responsibility, but it wasn't like, kids today, they split parenting and stuff like that. It was like, okay, he's out of the picture, and you go visit him on holidays or whatever. Very different, but also we know that males oftentimes have a lot of, I wouldn't say control, but they often have a lot of influence over women's decisions for family planning or birth spacing and things like that. And so involving them in things and helping them understand why some of these are important is really critical. And improving parenting. I noticed you had a measure around reading. This is so exciting for me. I love reading. And then collective impact, which someone else will kind of talk about, but it is that cross-sector collaboration. And there's some neat ways you guys can, measure that. Like what's happening now, and what, now, and how are we improving that? I think that's so cool. That's the collective impact triangle there. And then I would be remiss if I didn't kind of bring up this concept of, so it's great, we're going to look at all these kind of measures, but there are other things that impact health besides individual health behaviors. And I know level 1 grantees, you're working at the individual health, individual level, right? Because you're having those kind of interventions. But reducing, ultimately, Healthy Start's about reducing disparities in infant health outcomes, right? And with that real focus on infant mortality. But this visual here is from the County Health Rankings model. And it's just to remind us that social, economic, and environmental factors play a greater role in individual health outcomes than individual health behaviors. And I'll give you an example, like in Atlanta, like there's an obesity problem like there is everywhere else, but they don't have walkable streets. So you want me to do more healthy behaviors, but I'm scared to go out of my house after dark, and I have nowhere to go, and I have no sidewalks to walk on because, they're big giant streets and stuff like that. So that's an environmental kind of thing that's impacting my individual health behaviors. And so when you're doing your community needs assessment, just be aware that, it's not just behavior change of the individual. Sometimes there are structural things in your community that are preventing those individual behaviors from taking place. And so just to me, I could go off on this and do a whole training on, this aspect, but I'm going to have to stop myself now. That was more of just a reminder. And so a couple of different data collections I think you guys know as primary data. Well, I'm going to skip ahead because secondary data is where you start, right? Secondary data is data that has been collected by other sources. There's so many sources of data that you guys can use to kind of help you in your community needs assessments. One of the biggest one, I'm going to say, anyone have a nonprofit hospital in your community? Nonprofit hospital. A requirement of the Affordable Care Act is that they do community needs assessments. They now, in order to maintain their nonprofit status, they have to actually improve the health of that community they're in. Oh my Lord, what? The hospital has to improve the health of the community. Well, they may be collecting a lot of that data for you guys. So that's like amazing. So some of this data may already be done. Your home visiting programs. Your Title V programs at the state level might have PRAMs, that pregnancy risk assessment monitoring surveillance, that collect a lot of stuff like their diet, exercise, intimate partner violence, like pregnancy intendedness, smoking, like all these things that are part of the women's health thing. So a lot of that secondary data, there's some, already collected for you. And there's, national sets, and, I strongly encourage you if you want to talk to your state folks or whatever, but a lot of this secondary data, this is great to let you know what is there. And I would say, oops, no, I'm going the wrong way. I would say what isn't there. So like in my secondary data, I said, it can tell you, this stuff tells you the age of your cat, but it doesn't tell you how soft your cat is. And that's what primary data does. Primary data collection is actually really exciting to me because it's descriptive data. It's things that really can't be measured, okay? And there's a couple of exciting things, different kind of strategies in there that I've been a part of, but really this primary data collection can help you to understand kind of root causes. So like, for example, I worked with a rural community in Denver, and it was with doing teen pregnancy prevention. And we had kids that were really they wanted to get involved. So we did this photo voice project. Does anyone know what photo voice is? We gave these kids cameras, and they went around and they took pictures of their community. And their pictures were meant to tell the story about why teen pregnancy was such a big issue in their community. Well, they're in rural Colorado. There's nothing for kids to do. There's nowhere for them to hang out. And so, the community, all these different things. So they took these pictures, and this was really kind of profound, telling a story about lots of things going on in their community. So primary data collection is something that you're really going to have to think about. What is the stuff that can't be measured that you want to know? So things like intimate partner violence. I mean, you might see domestic, if you have a registry like Tennessee or whatever, you might be able to see those numbers, but you don't know about the community context that supports that, or why breastfeeding isn't happening. Maybe that's not a cultural norm, or those kinds of things. And that's the primary data collection can help you get to those kind of root causes and give you that more complete picture. And so, just aligning those two kind of data collection methods to kind of really help you to see that full picture of kind of the status of the way things are is really important. And like I said, on here I listed out a bunch of other kind of primary data collection methods. It's not the be-all, end-all, but it's just some ideas to get you started. Because you got to do data collection. This is important. And I want to emphasize this one. I love this. So I'm Russian, and we always look at the glass half empty. If anyone's ever read Russian literature, it's always the most pessimistic thing in the universe. And I don't know how I grew up in that family, because I'm always like, I see the opportunity in everything. I'm not following the footsteps of the glass half empty. But I do, when we even say needs assessments, it's identifying gaps, But I like to think of it as it's not just about gaps. It's also looking at assets in the community that can help you meet your program goals. Because every community, and I'm talking to the choir here, but every community has strengths, resources, and hopes. And your community needs assessment can help you uncover that. When you get the data together, you got to get yourself a system on how you're going to look at it, right? So maybe a way to do that is looking at strengths, gaps, opportunities, challenges. This is just one way, but you got to organize the data. You got to analyze the data. You can't just sit there and go, there's 5 strengths, 20 strengths. There's all these gaps. I mean, it's not just about compiling it in a report. It's really like, what is this data saying to me? I mean, what does this mean? That we have no groceries that sell fresh food in my community. Maybe that means I'm not really, maybe that's contributing to poor pregnancy outcomes because I don't have access to healthy foods or whatever. I mean, you really have to analyze the data. And some key questions is, what's it telling you? What's it not telling you? Like, what's not there? I like this one. What's surprising you about that data? Like, what didn't I know? How does this fit with what your stakeholders are saying, And where do you need to prioritize your efforts? And, this is emphasizing this whole thing that you guys are held accountable for, but it's, evidence-based programming. You have to make data-supported decisions. There's database decisions that only look at data, and that's it. Data-supported decisions use that same data, the stuff you guys are collecting, but they take into account people, issues, ethics, broader systems, things. So this gives you an opportunity to kind of say, yeah, I looked at the data, but I know my community, and this is what's going to work in my community or not. There's a subtle difference, but I would just I would strongly, encourage you to understand the subtle difference. It'll prevent some misunderstandings in your community. And there's many uses of data, for future funding, mapping power and identification of power brokers, improving community responsiveness in any way. But, so you got all this data, and you have to think about prioritizing it, because what does it mean? You guys can't do everything. You can't address everything that you find that's a need in that community. And so, you look at the major health needs, you've got to prioritize them. And you really have to start thinking about your Healthy Start program. What is it designed to do? How am I supposed to be addressing those needs? And that's where you select your needs. Okay, here's what I'm supposed to do. Here's what the community. You can't, you can't address all of them. If we had all the money in the world, that would be great, but we don't. We need to target our resources where they're going to have the greatest impact. And a logic model, Jeffrey, are you going to talk about a logic model? No, he's not. Okay. A logic model is great. It's a visual representation of what you're trying to accomplish. It's a great way to kind of put down what you're intending to do with your program. Oh, I could do a whole training on logic models. I love them. Taking those priority needs, thank you, she's giving me the 2 minutes. I told her I could talk all day. Taking those and putting them into an action plan, because what are we going to do with these? This is where the rubber hits the road. You know, once you made the decision, you have the community needs, you identified your evidence-based, programs or practices they're going to use. How are we going to get this accomplished? That has to be down on paper somewhere. You have to give yourself the roadmap to follow. And then, monitoring, evaluation, improvement is critical. People are scared of monitoring and evaluation. Really, it's easy once you have objectives and a clear plan of action. And your needs assessment is a type of evaluation. You're doing a benchmark of where things are now. And then in a year, you're doing an evaluation and saying, where are they now? And hopefully you see improvements. And if not, you got to feed that back and go, what could we be doing different so that we are seeing those improvements? You don't just do an evaluation plan and give it to your project officer. You got to use that to make improvements. And then just some things about implementing and then outcomes, and you got to use it for continuous improvement. And then this is my last thing, and you got to share back to the community. You asked me all these things, and you never told me what you were going to do. You never told me how well you were doing. So you really got to share back not just the community, but other stakeholders. If you're asking other partners to the table, you need to let them know kind of things that are happening, what the decisions were, why you're working on this and not that. I mean, that to me is really critical. And if you do your community needs assessment, you implement your plans, we're going to have success in improving healthy communities, which would contribute to a healthy America. My Lord, I did that in 30 minutes. Again, I'm Sharon Coral. I'm at the Association of Maternal and Child Health Programs. Obviously, I love to talk about all this stuff. If you ever want to contact me, I think my contact information is in there. But also, just look on AmChip for staff. I could talk all day about lots of this stuff. And so good luck, guys. I'm really excited about kind of new Healthy Start. I'm going to turn it back over to, who am I turning it over to? Okay.
Now we will hear from Dr. Jeffrey Guidry on how to use needs assessment data to show program impact.
What's so important about impact and what links our presentations is that you're not only looking at long-term. Most people, when they think of the word impact, they say, what is the long-term effect? And in these days, especially when we talk about budget and cost, you have to look at dollars, and you don't have 5 to 10 years. You have to show some level of impact. As Ms. Corley mentioned, Dr. Liu has to go to Congress and show what level of impact. So you're looking at the process, and then I'm just going to give experiences, examples from each one of my projects of how the needs assessment facilitated the impact evaluation. Okay, not to go into detail because she's already defined needs assessment, but the most important word here is to look at your target group. See, many people think one size fits all, and we know that, from going by clothes, right? Or, that's like a joke. You know how you see somebody and you say, oh no, one size should not fit all. But, okay, y'all are really sleepy. Okay, y'all not like my students, they at least, play like they're laughing at my joke. And then when they walk out, they say, what did he say? Okay. Now, the most important thing is to recognize with that needs assessment that you can document the differences within those communities that you're going to be targeting and that you're going to be working with. So that makes it very important. Now, I'm going to go through each one of these bullets, but I'm going to link it to how it's important to impact, for you documenting the impact of it. Can you provide baseline? Well, looking at the benchmarks and the performance measures that we're going to have, you have to develop baselines. So you're going to already have your baseline there that can show over 1, 2, 3, 4, and we usually do them by project periods, and you can show the differences. So you must have that baseline for impact, to look at the impact. Ensures your decisions are based on solid information. One of the things that the project directors come around and coordinators who I work with, how can we make sure that our decisions, well, we have to go back in and evaluate and document to see. Can help you set priorities. Now, that's very important, especially when you have limited funding. Help you set priorities among your program, your Healthy Start program. I know one example in South Carolina, we were looking at changing the scope of the work, and one of the things we went back to was the impact, to look at the evaluation to show what areas that we showed a better or increased impact versus another one, and so we were able to use, once again, that needs assessment. Program development. When you're trying to develop programs and initiatives, one of the things Ms. Corley stressed was allies and having collaborators. There's no way one organization or one entity can be responsible for all the maternal and child health for a community. So you're going to have collaborators and knowing to help you, especially with your program development. And you can give you some insight to any barriers or also improvements, which, as you know, as programs, we're always looking at improvements. So what about the process of how we link it? Decide what information you need to determine the impact. Remember, just like you did for needs assessment, as Ms. Corley presented, it's no different from looking at the impact, because your impact should be linked, documenting your impact should be linked to your needs assessment. And what is in the middle? Your program. Needs assessment, program, and then evaluation and looking at the impact. So you've already set your program based on the needs assessment, and as she mentioned, maternal, that they, Title V does it every 5 years, different organizations. I say at least a minimum of looking at every 3 years. Because if we wait to every 5 years, then I'll give you an example. We were in, I see Don Anderson back there from Central Oklahoma Healthy Start. I was meeting with them and we were talking about one of the issues that changed from their needs assessment was transportation. First of all, transportation was provided to this housing development that they served. And so I went back and I said, so what happened? So of course, they stopped the route. So the people didn't have access to it. I said, well, let's go back and show them from 3 years ago with a needs assessment where they had access, and then they can pull their records and show where they were utilizing the services, and then show now once you stop. Do you know they reinstated it? Also with a little political help too, right? Mr. Anderson, they had to contact a couple of politicians too, but it shows you how policy and program works together. And that was able to solve an issue that they brought the route back to the housing development so they can get there. So when we start looking at what information you're looking at, self-reported, of course, there are different ways. She's already, life expectancy, morbidity, we want to look at what is the level of disease. That's why they ask for HIV, AIDS in the community. In your target community, you want to go just beyond the basic maternal child health. Look at existing services. Also, you want to look at the behaviors, because especially when we're looking at health education and providing education and evidence-based, one of the outcomes, did you change behavior? Were you able to document the role of the lifestyle change that came in there? So that documents that impact, and that moves us to looking at evidence-based. What is the cultural environment? The environments are different. We're looking at different environments. I know earlier today a colleague was bringing up the role of how they're developing a lot of Latino work, a lot of Latino information that they're focusing on. So once again, what is the cultural environment? And also, what is the culture of that community? Because that community can change. Don't we live and see the way communities are changing? You know, just go to some of your major cities. The downtown area used to be where there was a lot of housing developments. Now what they're high-rises. So now there's a lot of changes there, but then that causes an issue. I know I was in Nebraska. We were providing a TA visit on GIS, and we were talking about how their major site that was across the way now is going to be some type of high-rise housing, so where their clients are now are what? Spread out throughout the communities. So when we see how decisions can make, and I see my colleague from Nebraska sending that. So I learned something once again looking at that environment. Let's look at, she already talked about existing information. A lot of people think a needs assessment is that you got to spend a lot of money and put into it. You have to put the resources, but a lot of the data is already available from maternal and child health, from the March of Dimes, like you said, from the different organizations and your colleagues. And I was glad to hear about the requiring the nonprofits to do it. I don't know how many of you are required when they used to do that, when they would get like money for care that wasn't paid for free care. They had made them require to do a certain amount of care in order to maintain a nonprofit. You had to provide disproportionate, I think it was called, disproportionate amount of care, so that's good. Internal versus external. When you're looking at the impact, are you going to look at your client level data, or are you going to look at external and look at what's existing? So remember, there's two types of data. And I always say this when I do my, we look at impact and look at the role of evaluation, that we have our internal data that's collected, then we also have external to find out. Data sharing, always look at that. And once again, we talked about the role of collaboration. She already mentioned qualitative versus quantitative, of how you got to look at data. You start off, of course, with quantitative to see what's out there. What are the major indicators? All of us had to do that in order to qualify for the Healthy Start project and qualify to be able to apply. Performance measures and benchmarks, they already give you your initial needs assessment data you needed. So you knew you had to go in and find that data, and if you didn't could not locate it, you had to state of where, locally, of where you would gather that. And of course, budget and cost sharing, especially when you're collaborating. Analyze the data. We're looking at GIS. We do a lot of GIS work. It helps us with outreach and recruitment. And I'm going to show you in Healthy Start New Orleans, when we were looking at expanding into another parish, one of the things that we did was looked at the GIS in Jefferson Parish and said, hey, they have moved there. We brought that information to our project officer, Angela Hayes Tolliver at that time, and we were able to do an expansion. So that's just an example of how using these different methods, you can document not only your impact, but show where you can do program improvement. Another thing you can add, but I think Willie told me some people have already started sending in their impact reports, is that you can have your priorities set, that like we're doing with my projects, from 14 to 19. What are some of your recommendations that could be used for it, that could be based on this impact? I'm doing that with my projects. Let's look at it. I'm meeting with them. Let's set our recommendations and priorities for the next 5 years, and then we can use that as another indicator. Almost finished. And then make sure you do presentations of indicators at the local, to your consortium, now/CAN, and make sure you keep them informed of everything and looking at the impact. I even say of right there, Healthy Start New Orleans is an example. Financial resources, we already know that at different levels, you're going to have a different level of focus. That's why one of the things I was glad with the FOA that it showed different levels and requirements that you need to document the impact and to evaluate your program. One more. Keep careful records. Look, she said stop. Careful records. Monitor access. And the last 3 most important words. We're trying to see what's effective about our program. How can we improve it and make it more efficient? And also accountability is a big issue, and it's going to be more so in the years to come with limited resources. Thank you.
Thank you for listening to the Evaluate Need and Impact Plenary from the 2014 Maternal and Child Health Bureau Healthy Start Convention. For access to the slides and more information on this topic, please visit www.healthystartepic.org.